Everybody, this is Dr. Ben Pearl. Today I'm going to be talking about knee injuries. So I sustained a knee injury in 2001. It was playing soccer on some dry clay. I had the wrong cleat and boom, tibia went over femur, and that was that. So what happened with that is that my ACL was disrupted, and the other thing that occurred was that the meniscus was shredded. I had what's called a bucket handle tear. So it was scoped, cleaned up well, but I still had some deficiencies. So I did some physical therapy. So I'm going to talk to you about what to do if, let's say, you're coming off an ACL, dislocated knee, or just runner's knee, some things of that you need to bone up on the strength in your knee. The first one we're going to talk about is four-way quads. Okay, so this was something that was shown to me by my then orthopedic surgeon, Charlie Jackson, Dr. Charles Jackson, who was, at the time, the team doctor for the Washington Redskins. So here it is. I'm going to take a look at the knee here, okay? So I'm going to bring my knee up, and this is quad number one. Up towards the sky, resisting with your hand. Quad number two. We're gonna clasp our hands like this, and we're gonna go in the reverse direction. We're gonna go down, and we're resisting. We're putting our quad down up against the resistance of our two hands, cradling the back portion of just behind the fold in the elbow of the knee. The third one we're going to do is we're going to have our hands here, and I'm going to drive my knee in the inward direction while my hands are pushing up against in the outward direction. Now we're going to do the opposite. We're going to laterally hold, okay, the outside of the knee, and then we're going to push this way while my knee is going out that way. So those are the four-way quads. Now the other one that I like to do, imagine that you have a softball, baseball. You can use something larger. You could use a Nerf football, even a basketball. The smaller the ball. The next exercise, you're going to take a ball. Now, it's best to start out with a ball a little bit bigger than this. This is about the size of a baseball or maybe just below a softball. So a softball could work. You could even use a basketball. The smaller the ball, the more challenging. So then what I'm going to do with that ball is I'm going to put it behind the popliteal fossa, behind my knee. And if we get a side angle so we can show everybody exactly what I'm doing here, I'm contracting the vastus medialis right here. This is the VMO, and the way I'm doing that is I'm trying to contract the muscle and push up against the ball into the back of the wall with the contraction of my quad. The last series of exercises, these are for more progression once you're not at a more dangerous point. So for instance, if you just dislocated your kneecap, you're not going to want to do any provocative hamstring curls, quad sets that involve extension and flexion of the knee. It's best to do more of the very controlled isometric contractures, which are just against resistance. So you're not actually moving the body part. You notice even on the back wall exercise, we did not actually move the body part. So those exercises are more advanced. And then the final series of advancements is balance drills, which you can do one-legged balance drills, and then you can be more provocative and one-legged jumps. Those also have to come much later. And when I say jumps, I'm talking about baby jumps. So till next time, hope your knee health is better. Keep on getting out there. Till next time, Dr. Ben Pearl with FitFoot U.